has come. If the facilitator for this session who has the screen up could just go ahead and advance to breakout room 4 slide. It will be a little bit down the line there. You guys are welcome to begin. Thanks again.
All right, all set.
Awesome. I'm Sarah, everyone. I am one of the chief residents from Children's National in DC. Somehow I got the job of facilitator, so I will do my best with the help of Kristen. Thank you for pulling up those slides. I think let's just go ahead and introduce our program directors who are going to talk for a few minutes. I think they said about 5 minutes for each program director. I'll try to keep an eye on what questions are coming in the chat, and then we'll save all the questions for the end, for the last 15 minutes. So I think our first up to speak, I hope, is University of Maryland, Dr. Eric, oh boy, Gudais, perhaps?
Gudais?
Oh, there we go. Okay. I think that your infographic should be on the next slide, Kristen, I think. Hopefully. Oh, one more. There it is. Okay, go ahead. Take it away.
Great. Thank you so much. I really appreciate everyone for allowing us the time to speak today. My name is Erin Gudais. I'm the Pediatric Residency Program Director at University of Maryland, and this is my 15th year running the Pediatric Residency Program, and it's a whole lot of fun, and extra fun this year during COVID and all the fun with virtual times. So I'll get the chance to talk to you a little bit about our program, and I also want to save a moment at the end of my time for each of my residents to say a quick hello so you know who they are. So first of all, as far as Maryland is concerned, some of the things I think that really make our program unique include the amount of individualization that is available for our residents. Each of our residents is able to individualize their education based on what they're interested in. We have pathways based on your career paths, and we have tracks based on your interests. And the size of our residency program really allows for our residents to work with mentors to help them to design some really neat individualized electives during their second 2 years of training to really help them to get what they're looking for out of training. Wellness is a big focus for us. We support our residents' wellness in a number of ways, including resident retreats. And one of my residents, David, who's with us today, was at one of those retreats today. So we're really excited about that. Many different aspects we have for wellness, and we really focus on helping our residents to build those resiliency skills. Diversity is a big focus for us. We have a diverse patient population in downtown Baltimore, and our residents are really passionate about advocating for diversity issues, and we're excited about that. We have a new diversity council, which has been rejuvenated with new subcommittees. So we actually have 3 different subcommittees of our diversity council, including our education subcommittee that is actually in the process of making a social justice curriculum, which is more robust than what we had previously, and we're excited about that. We also have a recruitment and mentoring subcommittee of the diversity council and a community engagement one. And part of our community engagement subcommittee is engaging in a free vaccine clinic tomorrow for downtown Baltimore residents. In addition to that, I think whenever I ask my residents what they are most enthusiastic about with our program, they often say their fellow residents and how they really become each other's family while they're with us. So I really think the size of our program really allows for us to be a residency family. As far as the size of our program, we actually have 15 categorical residents per year. We also have 4 med-peds residents per year and 2 pediatric emergency medicine combined residents per year. That's a relatively unique program for those of you who haven't heard of it. There's only 4 of them in the country, so it's okay if you haven't heard of it yet. It's a pretty neat program. So we have a total of, with all those 3 programs, a total of 71 residents. Most people put us in the medium-sized bucket. You can decide what you think when you hear about other programs, but that's the basket I think most people put us into. On our website, which is really the greatest source of information about our program prior to coming to us for the interview, and our website address is here on these slides as well. On our website, you'll see all of our awesome residents' bios with pictures, where they're from, and a lot of great information about them. One of the things I'm most proud of about our residency program is our graduates. Our graduates do amazing things. About 1/3 of them go into primary care, about 1/3 go into fellowships, and about 1/3 go into hospitalist or acute care. We have leaders in child advocacy, including some who have bios on our website, who are graduates who are doing neat things with advocacy with the AAP. We also have leaders in research. Many of our residents actually go on to present their research at national meetings while they're with us in training, and that's exciting. And we have graduates' testimonials on our website. So if you go there, you'll see some information about those who've gone on. I actually got a chance to see a number of our alumni today when we had our pediatric 3rd-year resident retreat, and we have a panel of alumni come back to talk with our residents about the next stages after residency. You'll note here on this slide that there's 2 main ways of contact, one of which is our website again to learn more about us. And then my pediatric residency coordinator, who's also pictured on this slide along with me, Val, that's her email address. And then at the very bottom there, you'll notice our Instagram account, which is another really fun thing this year. Actually, our residents have an Instagram takeover where they're actually all taking turns putting out fun images and information on our Instagram account. So with that, I'll pause for a moment to allow each of my residents to say a quick hello so you know who they are.
Hi, my name's David Sayre. I'm a PGY3 categorical. I'm actually one of the rising chiefs as well after GPR and doing primary care in the community. Nice to meet you.
Hi everyone, I'm Katie. I'm one of the PGY2s at the program. After graduation, I'm interested in a GI fellowship. I'll keep things short for now, but I look forward to talking to all of you in the after hours portion.
Thank you so much. That concludes our session.
Wonderful. Thank you guys so much. And everyone, you can add questions for them if you have any in the chat, and we're kind of keeping a list of them so that we can bring them up in those last 15 minutes if anyone has any questions. Oh, that's my timer. Okay, I'm trying to stay on time. Our next program is Johns Hopkins. So I'm going to let Dr. Oh man, you guys have hard names. Shilkovsky
Yes.
take over.
Perfect.
Awesome.
Yeah.
Great. Wonderful. It's all yours.
Hi, everyone. So my name is Nicole Shilkovsky, and I'm the Residency Program Director at Johns Hopkins. And you can see there our Program Coordinator, Carly Hyde, that I'm sure many of you will be in touch with during interview season. We are located in Baltimore, Maryland, which, as Erin just finished telling you, is quite a wonderful city to live in. It's actually recently rated one of the top places for millennials to live. And as mentioned by my colleagues, it's a great place to train due to the diversity of the population that we see. So a really wonderful group of patients to work with. As far as our program highlights, we have tracks in both health equity and global health. Those are specific tracks that you match into as separate NRMP numbers. However, we also have what's called mentorship pathways for people who have interest in these areas and would like to have academic pursuits in the areas of healthcare disparities, medical education, and quality improvement and patient safety. One of the neat things about our program is that we have quite a large number of advocacy rotations. One of the most popular ones is an elective with the Indian Health Service. That's in Tuba City, Arizona. And the program pays for residents who would like to go out there for an elective to go out and spend a month, and we pay for your flight and your accommodations and a rental car while you're there. So a really wonderful way to see a different part of the country and see a different patient population than what you experience in Baltimore. We also have a rotation with the American Academy of Pediatrics where you can do an internship in Washington, D.C., focusing on legislative advocacy. I would estimate that about 40% of our residents pursue international elective rotations as well. We have current very well-established sites in the Philippines, Madagascar, Haiti, India, Nigeria, Kenya, Guyana, However, those are rotations that occur every year for either 2 or 4 weeks each, and residents have the opportunity to go with grants, scholarships to each of those countries, and so those are fully paid for as elective opportunities. We are the publishers of the Harriet Lane Handbook for house staff, and if you are familiar with the Harriet Lane Handbook, many people know that it's published at Johns Hopkins. A lot of people don't realize that it's actually written by the residents and revised and edited every 3 years. So as part of that, we have quite a large focus in the program on leadership development. We really think of our goal of the program as developing future leaders in pediatrics, regardless of what you do after graduation. So we do have a strong residents as teachers focus and graduated autonomy within the program. We also have quite a large emphasis on diversity and inclusion within our curricular programming. We just started a new Racism in Medicine series as part of our noon conference, and we have a diversity council that focuses not only on recruitment, but also on mentorship within the community, and quite a large number of community outreach programs. Lots of wellness and social events every month. Each class has a retreat as well, usually in the spring or summer months. We're very close to the eastern shore of Maryland and Delaware, so lots of great beaches to go and spend time not only with family, but also as a class as part of the retreats. Some of our curricular highlights: we have a total of 6.5 elective months. We have, as I mentioned, a noon conference series daily. Our morning report occurs 3 days per week, and then the interns have dedicated time with our chief residents weekly for chief rounds. And then multiple different sites for continuity clinic, depending on your focus. We have one clinic that focuses mostly on Latinx health. And so for people who are Spanish speakers, that's a very popular place to have clinic. We also have several community-based sites as well for people who come into the program knowing that they're interested in primary care. About 22 residents per year in the categorical program. We also have combined programs with peds anesthesia. We have a peds neurology program, a peds genetics track, as well as a prelim year for people going into child psychiatry. And I mentioned a little bit about our tracks. We also have research pathways for people coming in with who are clinician scientists or physician scientists who have MD, PhD backgrounds. 3 different main clinical sites, not only at the Johns Hopkins Children's Center, but we also have a community hospital that we're affiliated with, and the Kennedy Krieger Institute, which was where our residents do rehab medicine and behavior and development rotations. Our website is there if you want more information. We just did a lot of major updates to the website, and we're very active on social media. So you can see there our Twitter handle, our Facebook site, and our Instagram site. So welcome you to check out a little bit more about our program, and happy to take any questions that you guys have, and really hope to meet many of you during the interview season. And I'll just pause for a moment. One of our chief residents, Jeanette Beaudry, is also on the call. So Jeanette, if you could just say hi.
Hi, my name is Jeanette. I'm one of the chief residents, as Nicole mentioned. And I, at Hopkins, we do it a little bit differently. You go and do something for a year before coming back as a chief resident. And so I was a Peds ID fellow last year, and I'll complete my Peds ID fellowship after this, and have really loved the program.
Thanks, Jeanette. So that's us at Hopkins. Hope to meet many of you in the future.
Awesome, thank you so much. Next up, I think we have the Sidney Kimmel Medical College and DuPont Hospital for Children. I believe Dr. Selps is here, and I'll let you take over.
Actually, it's Dr. Lorch. Dr.
Okay.
Selps is not available. So hi, I'm Margarita. I'm the associate, or one of the associate program directors for the Sidney Kimmel Medical College, Nemours AI DuPont Hospital for Children Pediatric Residency Program. In addition to having the longest name of any residency, I think, we are also the only children's hospital in the state of Delaware, which allows us to have a very large catchment area with a very robust and diverse patient population. Our hospital was built about 5 years ago, going on 6, I believe. So we have a very new facility. In addition to time at DuPont, you would also do time in Philadelphia at the Thomas Jefferson University Hospital, as well as our primary care site at Jefferson. And we do time at the Christiana Christiana Care Hospital, which is in Newark, Delaware. And so you get a broad range of urban and community settings. We have, as I said, a large catchment area that goes from southeastern PA and southern Jersey through all of Delaware and part of northern Maryland. And our patient population ranges from inner city to suburban to rural. So we get a little bit of everything. We have 22 categorical residents per year, in addition to 1 child neurology resident for both the first and second years. We have a med peds program that is based out of Christiana as well, and those residents do share time with us. And we have a pediatric physical medicine and rehab residency as well. Our program, about half of our graduates go on to do general pediatrics and about half on to fellowship. Those numbers may change as the hospitalist fellowship becomes more prominent, but right now it's about 50%. Wellness is a big focus for us. We do multiple retreats throughout the year for each of the classes, focusing on professional and personal development as well as work-life balance. In addition, we have patient safety focused retreats and skills fairs. We just actually are in the middle of retreat season and had our second year retreat today. We have training in medical ethics, child abuse, and palliative care, in addition to our standard rotations. And there's a lot of opportunities for advocacy, both locally and nationally. Nemours actually has an office in Washington, D.C., where you can go to spend time lobbying on the Hill for children's issues. The Philadelphia and Wilmington area is really just a wonderful area to live in. There's a lot of options. Half of our residents about live in Philadelphia, half in Delaware. There's a lot of cultural and culinary opportunities. We're near the beach, we're near the mountains. It's just a wonderful place to live. Some of our curricular highlights include our career selective, where during one of your outpatient rotations, you actually have the opportunity to go and spend time in an office where you might, either a primary care office or a subspecialty office in the career that you might think you'd be interested in. We have a resident as teacher rotation that the residents do as second years, where they get to spend time developing their teaching skills, both towards the medical students as well as the residents. They run mock codes, they do several board review sessions, they do several bedside rounds with the medical students. We have a large number of electives throughout the course of the residency, 2 of which occur in the first year. And then we also allow for research electives for project work. A large number of our residents do go on to present at national conferences such as Pediatric Academic Societies and AAPE. We have a global health track available. If you're interested in global health, we have trips that often go to Haiti, as well as the Gambia, obviously not this year, but that has been our places that we have traveled in the past. And we are on Instagram, so it's good to follow us there, as our second year residents today became TikTok stars during their retreat. So definitely recommend checking that out. So I'm just really happy to be here. I hope to see all of you on the interview trail, and good luck to all of you as well.
Wonderful, thanks so much. Our next presenter is Inova Children's Hospital, our neighbors. Dr. Donnelly, I'll let you take over.
So I'm not Dr. Donnelly, I'm Patty C.O. Mayer. Dr. Donnelly had a previous engagement, but I'm one of the associate program directors at Inova. I'm a peds nephrologist, and I'm here also with my other co-APD. We are Dr. Donnelly's left and right hand. Dr. Meredith Carter will join me in a little bit. We're really here to kind of tell you a little bit about our program and see if you're the right fit for us and vice versa. You know, we are really fortunate to be in a region with wonderful programs, as you've seen, with wonderful collaboration. And I tell all candidates, there are so many great programs. It's a matter of finding the one that's right for you. So here's our effort to kind of tell you a little bit about us. Dr. Carter will go ahead and start with kind of describing the program.
Hi, I'm Meredith Carter. I'm the co-APD along with Patty C.O. Mayer. I'm a pediatric hospitalist, and I've been at Inova for almost 14 years now. Inova is a medium-sized program. We're located in Northern Virginia, just a little bit outside DC, about 15 miles outside the city. We're a children's hospital within a hospital. The children's hospital itself has 226 beds. It's located at the Inova Fairfax Medical Campus, which is about a 1,000-bed hospital. Inova Fairfax is an independent academic medical center. We currently serve as a branch campus for the VCU School of Medicine, which we have since 2005, and we're in the process of transitioning to a branch campus for UVA for next year. We were actually the first residency program at Inova starting back in 1996, while the GME program at Inova has expanded significantly since that time. It remains very much resident focused. We do have a few fellowships on campus, but it is very much resident driven and resident focused for the GME program. We firmly believe that there is a huge benefit to any size program, whether it's small, medium, or large. You know, and I also firmly believe that all residents will really thrive in whatever environment they find themselves in for residency. There are a lot of similarities, there are a lot of differences, but I think ultimately you guys all got to this point in your lives and making it through medical school into residency, and I think you're going to thrive wherever you find yourselves following medical school. Some of the benefits of the medium-sized program that we have, it's 13 residents per year. We are large enough that we have the breadth of subspecialty care and certainly a large volume of patients from whom to learn, but we're small enough that it allows for a lot of individualization. As I'm sure many of you know, all programs are required to have an individualized educational curriculum for their residents, but there's really no prescription for how that happens. We have taken a very individualized approach, and we walk our residents through a very formalized method for identifying their career goals and then coming up with their curriculum based on that. We have about, and we try to prepare everybody for whatever outcome or whatever careers they plan to go into. We have about 50% who go into fellowship and about 50% who go into primary care. And with that, I'll go back to Patty.
Yeah, so one unique part of our program is our patient catchment area, and we are fortunate to be both part of the DC metro region and also located close to central and western Virginia. So we have a really unique variety of true rural communities that come see us, as well as more urban populations. You know, even in our home county, which is Fairfax County, the school system cites that over 180 languages are spoken by children in the homes of these families. And so we have the great fortune of interacting with all of these people in our community. We like to say that we see bread and butter as well as high-level tertiary care. And I would also say that we see extremes of privilege. So extremely wealthy, you know, Fairfax County has some of the highest earning demographics, but also some of the larger populations of immigrant and refugees. And so we really have the fortune of being able to think about how we best care for all of these children. We have had an active diversity and inclusion committee for years. Obviously, newfound interest in increasing awareness of anti-racism and a curriculum to really teach our faculty and residents how to directly address issues related to bias and racism. So we're very excited and led by our residents in some of these projects. And the other piece that I think is unique is we are also very interested in advocacy because of our location. We are able to allow our residents to go to the AAP national office as well as to other sites. And we also take part in pretty active Virginia AAP activities, which are in Richmond, and seeing that kind of unique things that happen at state advocacy, especially when you're in a purple state, is really challenging and also interesting. And I think, you know, I really feel for you guys. I remember being in your situation many years ago. It seems like there's so many great choices, and the truth is there are so many great choices. And you guys will all do fine. You know, we're looking to recruit a class that will thrive with us, that will reflect the patients that we take care of, and that will achieve whatever they choose to. There's a little typo there. We are actually on Instagram, not Twitter. Our residents decided Instagram was the mode of, and I'm not saying that some of the program directors don't know the difference between Instagram and Twitter, but that you know, our residents felt that they could best encapsulate sort of their daily lives on Instagram. So that's where they are. Thanks so much, and good luck to all of you guys.
Good luck, everyone.
Awesome. Thank you so much. Okay, we have two more. The next one is we're moving a bit north to the University of Massachusetts. We have Dr. Fahey.
Yeah, hi.
Hi.
Thanks everybody for coming out on a Friday night. I'm Mike Fahey. I'm the program director for the residency program at UMass in Worcester. I'm joined tonight by one of the associate PDs, Tina Hermos, and one of our chief residents, Kristen Richard. After I'm done talking, it'd be great if those guys could just say a quick hello. I'll try to keep my comments relatively brief. Our program is a medium-sized program. We have 8 categorical peds and 4 med peds residents per year. We're located right in the central Mass. Worcester is the second biggest urban area in the Northeast region. And we have a pretty large catchment area. It extends as far north as patients coming in from southern New Hampshire, as far south as patients coming in from northeastern Connecticut, as far west as the Connecticut River Valley, and kind of as far east as the kind of outskirts of the Boston suburban area. And so it's a pretty large catchment area with a pretty incredibly diverse population that we serve, diverse from a racial, ethnic, socioeconomic background. So the patient population that we serve is pretty unique and pretty special. And as such, we see a pretty wide variety of really interesting pediatric cases that come through our doors. I'd like to think of our program as kind of a right-sized program, which is to say that we're big enough that we have pretty much all the pediatric subspecialties represented. The one that kind of sticks out that we don't have at the moment is pediatric rheumatology, and that's just because our rheumatologist retired. But we basically have all the other pediatric subspecialties represented. However, we don't have any fellowships with the exception of neonatology. And what that means is that when you're a pediatric resident in our program, you're really getting that kind of apprentice style learning in all of those subspecialties. Now, that said, we're a primary care driven residency program. So UMass Medical School is consistently ranked in the top 10 for primary care medical schools in the country. And UMass was actually founded with the mission of producing the next generation of primary care physicians to serve patients in the central Massachusetts area. So as a residency program, we end up producing about a 50-50 split between residents who end up going into primary care and 50% of residents ending up going into subspecialty medicine. So despite the fact that we have kind of a primary care mission and lean, I think that the residents get such a great subspecialty exposure and experience in teaching that a lot of them end up getting drawn into subspecialty medicine as well. So no matter what your interests, you're going to be well served in terms of your training at UMass. Probably the thing that stands out most at UMass is the strong bonds between the residents and faculty. And I would also say the students and the residents. Our residents are excellent teachers, and that's because our program really focuses on giving the residents autonomy, and that's autonomy with respect to patient care and autonomy with respect to teaching our students who rotate with us. We like to empower our residents, and we definitely graduate confident residents who go out and, no matter what they end up practicing. We have a global health fellowship, which is one of the few programs in our region that has a global health fellowship, and that offers some special opportunities as well to our residents. So I said that we have all these subspecialties, but the other thing that makes it a right-sized program is that we're small enough to really feel like a small program. Everybody's on a first-name basis between the faculty and the residents. All the residents have all our cell phone numbers, and they're texting us all the time and everything. And it's just a great place to be. I've been at UMass about 12 years now, and I've just never had any inkling to go to go anywhere else. It's a great place to work. It's a great place to learn, a great place to practice medicine. And I think you'll agree if you come and interview with us and you get a chance to see, for example, one of our morning reports, and you get to see the way that the residents and faculty interact. I don't think you'll be disappointed, and you certainly won't be disappointed if you come to train with us. So I'll wrap things up there. And maybe if Kristen and Tina could just give a quick hello. And thanks again for coming out on a Friday night. We hope to see you over the course of the interview season.
I'll say hello. I'm one of the associate program directors and on the infectious disease faculty. And I've been at UMass for 10 years. And just like Mike said, it's a second family. We all love working together. We're all passionate about resident education. And we have a really special continuity clinic model where our residents are paired up essentially one-on-one with their continuity preceptors, and just get an amazing hands-on experience with their clinic and have a lot of patient ownership. So even of those 50% who go into fellowship, they're amazing primary care doctors, which as someone who went directly into fellowship, it's such a great skill set to carry forward.
Hi guys, I'm Kristen. I'm so excited to be here. I'm one of the pediatric chief residents. I look forward to meeting you guys at the Q&A. I echo everything Tina and Mike said. My heart is truly in this program, so I can't wait to share my exceptional experiences with you guys. And Worcester is truly a hidden gem of New England. I love living here, and I'm a very confident resident teacher, which is a true highlight to our program. So I look forward to sharing more with you in a bit.
Awesome. Thank you, guys. And then last up, we have my home program and my program director, Dr. Aisha Barber. So I'll let her take over.
Thank you, Sarah. I'm Aisha Barber. I'm the director of the Pediatric Residency Program at Children's National in Washington, D.C., and I'm a pediatric hospitalist. And I have to say, please excuse the lively sounds of my kids enjoying Fun Friday downstairs with their grandparents. I hope no one busts through the wall right now. I have the pleasure of working with a remarkable team that includes Sarah Duran, who's one of our chief residents, and she's been driving Breakout Room 4 tonight. And I'm happy to close out the program presentation to tell you what we feel is special about Children's National. I started working at Children's National in 2006, and I would say first and foremost, my favorite thing about Children's National is the people we work with and the people we serve. I was drawn to Children's by the diverse community of patients we have the privilege of being trusted to care for. We are a 2-in-1 kind of hospital, so we serve Washington, D.C.'s incredibly diverse community as the city's primary community hospital. And we also serve the larger region and areas globally as a freestanding children's hospital and quaternary care referral center for specialty care, including pretty much every subspecialty you can think of and every specialty clinic you could imagine. My youngest child has gone through our whole system from the NICU to the OR and had the privilege of being cared for by people that I helped to train, which really brought the big picture of what Children's National is home for me. Due to this practice model, we do end up every year with a nice mix of graduates going into primary care, hospitalists, and other subspecialty fellowships, and other interesting career pathways like advocacy, public policy, and global health. We focus on providing well-rounded general PEDS training that can be a launching board for all kinds of careers. And we really hope to build on intellectual curiosity to kind of meet our goals. But we're also really glad to be able to provide unique ways to individualize residence training. So if you have a specific area of interest before starting residency, you can apply to one of our 7 tracks. And if you're still exploring areas of interest, that's wonderful, and our environment supports that also. Any resident in any track can participate in all of our electives and our pathways, which are constellations of electives and other experiences with a particular focus. So we have particularly robust pathways in global health, child advocacy and public policy, and medical education. Let's see, with regard to our areas of focus, diversity and inclusion is a big one. We value all of our differences. We're really enthusiastic about growing and evolving with regard to our approach to diversity and inclusion. And we try to embed that in everything we do. And hand in hand with diversity and inclusion is the issue of health equity for marginalized populations. And there are definite inequities in Washington, D.C. So part of our program's mission is to train pediatricians who are prepared to address these inequities, whether they end up working in primary care or in critical care. Our partners in the Child Health Advocacy Institute make this really, truly unique location to learn about health equity, which I think is an important competency for all pediatricians. It is an advocacy institute based inside of our hospital that focuses on data collection and community advocacy, but also national advocacy and public policy as well. And we partner with them to create an equity initiative within our residency program to help further teach and learn together about really dismantling structural racism and other inequities at all levels and in all the areas where we work and train. Wellness is another essential area of focus for all of us. Regardless where you end up doing your residency, training will be hard at times. So we're dedicated to providing individual support as well as a structured well-being initiative that incorporates many disciplines and guides us in developing the skills we need to care for yourself while caring for other people. Our residents spend a lot of time teaching, like many programs mentioned, and so we really do focus on residents as teachers and throughout training, and many of our residents go on to have an academic focus in their careers. And finally, one area that we consider ourselves unique as well is research. Residents who aren't certain whether they're interested in research when they come in can apply for our REACH program, which stands for Research, Education, Advocacy, and Child Health Care, where second and third year residents can apply for a protected half day a week for mentored research projects. And with that longitudinal time, residents can really take a deep dive into whether research should be part of their future careers. And then for residents who are sure that research is a part of their future careers, we have the research track and our NIH-funded R38 program, where residents can apply after already being a part of our program to extend their training to do more research. So that's just a bit of what makes Children's unique. I think most importantly is the people you train with. And our residents are diverse in every way, and I really feel that that's our strength. When I was in your shoes, I think I started off unsure about whether a larger program was for me, and I ended up with my co-interns feeling like my 39 brothers and sisters. So I think we are, a place that is a larger program with a small program feel, and I think that's an important piece for us. I know that these are special times that you're applying to residency in, and so I feel like it's important to say that this will all work out. Having had the opportunity to get to know and work with many of the pediatric program directors across the country, I feel like I can say with confidence that you have a ton of incredible choices, and that's a good problem to have, and that means you can't go wrong. So everyone's been incredibly supportive, and I think this will go just fine. Thank you for giving us the opportunity to chat with you. I look forward to answering questions.
Awesome. Thank you, Aisha. I think they said we're going to move into the after hours at 9:05, which means I've got 7 minutes to try to squeeze in some good questions. So one question quickly is, do you accept complex scores, and is there a minimum score requirement for any complex scores? Maybe let's just go one at a time from the top to keep it organized. University of Maryland.
We do accept complex scores, and we don't have a specific minimum.
Okay. Hopkins?
We look exclusively at USMLE scores, but we do not have a minimum.
Okay. And DuPont?
We do accept COMLEX scores. Our typical minimum is 550, but we do sometimes have ones that fall below that.
Okay. Inova?
We do accept and look at both COMLEX and USMLE scores. We don't have a specific number that we're looking for.
Perfect. And then UMass?
We accept COMLEX scores, no minimum.
Okay. And Children's National?
Same here. We accept COMLEX with no minimum.
Great. Okay, thank you. Other people are asking a lot about continuity clinics. So can you discuss your continuity clinics? What's your no-show rate? And then kind of along that line is do any programs have planned to move to an X+Y rotation format? I guess we'll go backwards this time. Aisha, do you want to talk briefly about our clinics? It's hard to do.
Sure. Continuity clinics. We have a wide variety of continuity clinic types. Some of them are located at the main hospital in DC. We also have continuity clinics at private practices and at special clinics throughout the city. Residents are matched one-on-one with a continuity clinic preceptor that they stay with for the 3 years. No-show rate, that's a good question. I think that COVID has affected everything, and for a while our no-show rate was a bit higher, but now we're back closer to baseline, and the no-show rate is really not that high. I should admit, I'm a hospitalist, so I can't tell you exact numbers right off the top of my head.
It depends on your clinic.
But it hasn't been an issue.
Clinic.
I'm sorry?
It depends on your clinic. We have such a wide variety of clinics that I think it depends on what clinic you're at.
Mm-hmm. And no plans to move to X+Y right now.
UMass?
Yeah, so I'll try to, there's a lot to talk about with our primary care program. I'll try to keep it brief. We have a mini kind of match program where our incoming interns, we try to set up the incoming interns like life experience and interests with the various community pediatricians, both within Worcester and in the community surrounding Worcester. So we really try to match you with somebody who we really think is going to be a good fit. Those programs are very varied and serve a variety of different communities, which is great. And all the interns actually have a night where they get together for dinner and they present the features of their specific kind of community that their primary care clinic serves. So that's kind of a way that you really get to know Worcester and the surrounding areas. We don't do an X+Y model, and we don't plan on switching over to one.
Awesome. DuPont, do you want to quick?
So I'll answer the X+Y question first. It is something that has come up in discussion for us. And we expect if we do so, it will be an 18 to 24 month rollout. So it will take a little while. As for our continuity clinics, so we have currently 4 continuity clinic sites, one of which is up at Jefferson in Philadelphia, and the other 3 are located, one is located in the hospital at DuPont. It actually serves a large complex care population, and then 2 others within Wilmington proper. The no-show rate, again, as everyone said, is very variable. Obviously, COVID has impacted it a lot. We have clinics that have very low no-show rates and ones that are a little bit worse. So it just varies.
Thank you. And then Hopkins?
Yeah, so I think very similar to what others have said. We don't have plans to go to an X+Y model at this time. I think our no-show rate is very variable because we have, as I mentioned in the presentation, we have the Harriet Lane Clinic, which is affiliated with the hospital and is right across the street from the hospital, and is very much an urban-focused clinic that might have a slightly higher no-show rate, whereas some of our community-based clinics and our clinic at Bayview Hospital, which serves a largely Hispanic and Latinx population, has not as large of a no-show rate, but plenty of patients to go around.
Awesome. And then looks like 1 minute left. Marilyn, would you like to?
We have a primary continuity clinic site for all of our residents downtown in our inner city, and then our residents have the opportunity to add a second continuity clinic in the community if they choose our community track. So I think that's kind of a neat experience for us. And no X+Y.
Awesome. Thank you guys, everyone. And thank you all for handling my facilitator job this evening. I think we're all going to go back in for the after hours to the main room is my understanding of what happens next. So thank you all so much.
Thank you.
Good luck, everybody.
Welcome back, everybody. If you could just make sure we're muted back in this big room, we're gonna get started here in 1 minute. Looks like most of us are back in. If you are from program leadership, we can't thank you enough for your participation this evening. It has been so wonderful. At this point, we would like to let you enjoy the rest of your Friday evenings as we transition to our resident-only portions. So once again, we thank you so much. We'll have our recordings posted and